projections about the health crisis unfolding in Gaza. In a minute, we'll be joined by one of the lead authors of a joint report from the London School of Hygiene and Johns Hopkins University, which found, quote, even in the best-case ceasefire scenario, thousands of excess deaths would continue to occur, mainly due to the time it would take to improve water, sanitation, and shelter conditions, reduce malnutrition, and restore functioning healthcare services in Gaza, unquote. In an interview with CNN last week, the regional emergency director of the World Health Organization, Dr. Richard Brennan, was asked about the report's projections.
This study is absolutely striking. I don't know how many wake-up calls we need to alert us to the dire, absolutely dire and desperate situation on the ground. We've already lost 29,000 people from traumatic injuries. We already have over 70,000 others that have survived injuries with some terrible injuries. I was in Gaza last week. You can't imagine the deformities, the limb losses of young children, young adolescents, young adults who are going to be left with these disabilities for years to come. We don't know how many people have died because they didn't get access to their blood pressure medicines or their diabetic treatment and so on. But we know that we suspect that thousands more have died unnecessarily because of lack of access to health care. And now you have these two reputable institutions. I know the two study leaders. No one is better placed to do these kind of estimates than these two institutions. And now we're saying if things continue, if we see this escalation, if we see this military operation into Rafah, we're going to be looking at an extra 80-odd thousand deaths in 6 months' time. If that's not a wake-up call, I don't know what is.
That was the World Health Organization's Regional Emergency Director, Dr. Richard Brennan. For more, we're joined in London by Zaina Jamaluddin. She's a nutritionist and epidemiologist, one of the lead authors of this new joint report from the London School of Hygiene and Johns Hopkins titled Crisis in Gaza, Scenario-Based Health Impact Projections. She's a research fellow at the London School of Hygiene and Tropical Medicine. Zaina, welcome to Democracy Now! Thanks so much for joining us. Just lay out your findings.
Hello, welcome. So as that was just mentioned, in fact, we have attempted to actually project what would be the excess mortality in different scenarios in Gaza. In fact, we know that there is the direct effect of the war, but however, we also wanted to understand what is the indirect effect of the war on infectious diseases, for example, mortality from COVID-19, increased excess mortality from maternal and newborn healthcare because they're not able to access health services, increased mortality due to the chronic diseases for specifically type 1 diabetic patient, people with chronic kidney diseases, and how much excess mortality would happen due to this. We also modeled the impact of acute malnutrition, which is what was just mentioned right now in terms of how much wasting or thin children would increase as an underlying factor to all of this excess death. So with this attempt, we actually find that in case of a ceasefire, around 6,000 to 11,000 lives would actually be dead and would have an excess death in the case of a ceasefire of around 11,000 deaths. In case of an escalation, we'd see around 85,000 deaths, which is currently what's happening in Rafah in the next 6 months. But also what's important to point out is in case of a ceasefire now, we would be saving around 75,000 lives.